Not all doctors will suggest or even mention immunological testing or treatment. That could be because it's not something they work with, or it's because they don't think you need it, given your diagnosis or your history, or maybe because the scientific evidence is still conflicting. But you may still have questions hearing about other women who get tested or where different immunosuppressant drugs are added to the treatment plan. So let's start by clarifying what immunological testing is and what the treatments are. We know that the immune system plays a role during pregnancy. If you receive a donated kidney or a heart, you must take immunosuppressant drugs for the body not to reject these genetically foreign body parts. But even though an embryo always consists of 50% genetically foreign material from the father, and sometimes 100% when donated eggs are used, the body doesn't reject it. The immune system basically adapts in one way or another in order to support the pregnancy. So a logical theory is that if a woman's immune response somehow doesn't work as it should, her body could reject the embryos, causing recurrent early miscarriages or repeated implantation failure. So an abnormal immune system can actually affect a lot of cells, one of them being the NK cells, otherwise called natural killer cells. NK cells are naturally found in the uterus, even when the woman is not pregnant, but the number increases enormously after implantation. It's still unclear what the role is, with some scientists believing that NK cells facilitate the development of the placenta, while others believe they attack the uterus, preventing a successful pregnancy. The levels of these cells could be tested with immunological testing, such as biopsies taken from the uterus lining. It is still, however, unclear what are the normal reference ranges and which levels should be assessed as abnormal enough in order to initiate treatment, and of course what the treatment would be. In general, there is still much debate around exactly what to test and how to treat in order to prevent fertility issues. And this is why different doctors and countries work differently within this area. More research is basically needed to provide clearer answers. So given what we know today, who is immunological testing and treatment recommended for? Well, if a doctor works with it at all, it would be recommended for women that have suffered repeated early miscarriages, that is, more than 2 or 3 in a row, depending on where you live, or if you've suffered repeated implantation failure, despite getting high-quality embryos, or if you have a known autoimmune disease, like lupus. But what if I don't have this condition? Couldn't I just get tested proactively to make sure there's no issue? Well, you should know that this is a complex area when it comes to testing. Even for a well-known autoimmune disease like rheumatism, no blood tests can definitely prove or rule out the disease, and doctors therefore have to look at symptoms like a swollen joint rather than just blood tests. Therefore, spending money and effort on tests is normally not considered worth it before an actual issue is confirmed, and when doctors can look at your test results and the treatment history combined. I hope this helps you to have a more informed dialogue with your doctor, and there is more information in the app if you want to dive deeper into different types of immunological testing.